Doing
I'm good. How are you?
good. So, a lot to talk about, lots going on.
Always.
Yes,
Always.
probably more this week. So, okay, the first question, and probably the most important question, do you think Halton and more importantly Burlington will be part of this lockdown that is kind of probably going to be announced this Friday?
Well, our numbers, as much as they have been climbing primarily in Oakville and Milton, they're still fairly low in Halton Hills and Burlington, but they are climbing. But they're still nowhere near the what we used to call the hot spots. You guys,
Yeah.
Toronto, Peel. Peel especially, and Brampton. So, we've always advocated for a targeted approach. I was comfortable with the move into red zone because we met the thresholds. But, do we meet the thresholds for a GTA wide or Ontario wide lockdown? No, I don't think so. So, we'll see what they do, but they clearly have to take action in Peel. There's no question.
You talk about the threshold of red, but they did change it in the middle of it. So were you, I guess, satisfied is the wrong word, but are you still there? Still there?
Sorry.
Oh, no
Sorry
worries.
about that.
Did you get a call in? Did somebody just call in?
You know what happened? It was a pop-up to update your software. Anyways, I'm
Oh,
very sorry about that.
no worries, call.
You said they changed the thresholds. Yes, they did.
Yeah. So don't worry, this isn't CP24. We can talk for hours. It doesn't matter, okay? So, yeah. Yeah. Well, you were talking about the thresholds, right? You meet the
Yeah.
threshold, but change the thresholds in the middle of, in the middle of everything, right? So, I mean, um, satisfied is the wrong word, but are you satisfied at being in the red zone when you guys weren't on the red zone before?
So what I and we as Halton mayors have consistently, and our regional chair, asked for is three things really: a targeted approach, decisions based on health indicators, and then transparency about what those are. And when you add those three up, we got that. So if the health evidence and the advice for the medical officers of health was that the thresholds were too high, and that was their advice. And so the government rightly listened and changed those thresholds. Once they were changed, we did meet the thresholds, and that's completely transparent. So all of that is out there. So I have supported this because it's exactly what we asked to happen in terms of a decision-making process, which is show us what you're looking at to make the decision and make it clear and transparent and base it on health evidence and advice. So they did. What I'm hearing from Burlington residents is, why are we lumped in with Halton? Because our numbers are good. I also hear from folks who are quite concerned and would support a total sort of Canada-wide or Ontario-wide lockdown. But we are part of the Halton Region Public Health Unit, and so those indicators are measured on a public health unit basis. And so we're all in this together, and we need to do what we can to be in solidarity with Oakville and Milton, whose numbers are going up.
There's just so much confusion. I get messages daily. I can't imagine how many messages you get from business owners, small businesses, and there is a lot of confusion. The question I get asked the most is, how long is this, red zone going to be around for in, these areas, right? And nobody knows. I mean, like it's supposed to be 28 days, but
Yeah.
Peel's 2 weeks. Anyways. How long is it going to be in red zone? Let's just say this Friday, a lockdown does not come for Halton. How long is it going to be in the red zone for?
That depends on all of us. It'll be in the red zone until we get our numbers down. And it's quite literally that simple. So what does that mean? What we received advice in October, so weeks ago, from our medical officer of health, that people really should be limiting their contact, especially social contact, to people within their own household. So if you're going to go to a restaurant, the advice was go with members of your own family, the people that you live with. So not even extended family. And some municipalities or medical officers are actually mandating that. That hasn't happened at the provincial or public health unit level for Halton yet, but that has been the advice. It kind of got lost in the in all of the discussion about the other advice she gave, which was around fitness and games and such. So people, there were all these other things too that people didn't really register. So that is really critical. What we know is that the virus spreads by close contact. It's as simple as that. So if you are interacting with a lot of different people outside of your household without knowing if they might have it or not, and remember, people can be asymptomatic carriers. They don't even know they have it yet. And they can transmit it. And we know that that's how it spreads. So in addition to wearing masks and proper hand hygiene, we must keep that 6-foot distance from anybody we don't live with. It's really that simple. And until that happens across the province, we're going to continue to see the situation that we've seen, increasing numbers and potential for more closures. So it's all on us to determine how long this lasts.
The Chief Medical Officer in PL, Dr. Lawrence Lowe, and Eileen Davila in Toronto have put more restrictions on top of the restrictions that the province have given. Is the Halton Chief Medical Officer going to do that, or is willing to do that?
So she has released guidelines, like I said, several weeks ago that were actually before Dr. Lowe and before Dr. Davila, and even before the Premier, when he announced the red zone last week, said, stick to people with your own family, go out only for essential trips. So that's been in Halton as a guidance for several weeks now. And so I'm not sure if there's a move provincially or at any other table to put that into some sort of legislated framework. We'll see how it goes. But certainly that guidance is there, and I would encourage people to follow it. Now, I have had people ask, what's an essential trip? Groceries, obviously, medical appointments, work, school, although that may be changing. We hear some rumblings that maybe there will be a school closure, but recreation is an important part, right? And if it can be done safely in a controlled environment, it's a world of difference between that and an unstructured, unregulated, if you will, social gathering where you're interacting with lots of people you don't live with, and the potential for spread is just exponential.
Have you, have you talked to the province in regards to advocating for small businesses in Halton and Burlington, or as a collective?
Oh, we send them letters and talk to them. I text the Premier. We call each other. Mostly I just wait for his call because I know he's a busy person, but we're always in touch. And our letter that advocates for targeted, specific, evidence-based restrictions still stands. All of that's true. And so, with the red zone, it's not a lockdown. There's still, businesses are still open. So people really, it's up to all of us to use good judgment, to follow the guidelines, and to make the safest choice, not only for us, but for everybody around us. Because you don't know if you might be a carrier and not knowing it, if you've had lots of interactions. So, just assume everybody has COVID. Just assume it.
Okay.
And conduct yourself accordingly.
Sure.
That has been a message from the public health officials as well. And if everyone did that, we'd get out of this a whole lot sooner. And nobody would be confused. That's a simple message. No one would have to count, are there 4 people or 6 at a table or 10 and 25? Just assume everyone has COVID, conduct yourself accordingly, which means staying apart.
Let me ask you this. Did you watch the press conference today with Doug Ford?
I did not.
No? Okay. Well, he was in a fairly, not aggressive, but he was in a bad mood in a sense. Like, a few questions got to him, and I was going to ask you if you did see it. I mean, what what do you think is going to happen this Friday?
Well, if the numbers keep going up the way they are, and he shared with us the modeling of a potential for 6,000, 6,500 new cases every day. If that happens, we're sunk. And, you know, you look at the exponential growth we had heading into the fall, where the numbers were looking good, and we all felt, you know, we've crushed this curve. And you look at the modeling, there was a spike in March, April. We brought it down, we flattened it, we did a great job, and then everyone got complacent. And it went right back up. And not only that, well past what it was at the beginning. And so we've seen that the speed, it's like a wildfire. It starts with something so small, and we see how quickly it can overtake in terms of the numbers. And that should be of concern to everybody. So, you know, he will make the decision that needs to be made based on the advice of medical officers of health that are around him, and to try to knock this back. And but most importantly, it's not just up to us elected officials or even the medical officers of health. We have a personal responsibility to stay 6 feet away from anybody you don't live with. That is critically important now. Always was.
Yeah.
The spread won't stop unless we all adopt that behavior.
The provincial numbers today, I think the Halton numbers might be a little different, but 63 cases today in Halton. What are your thoughts? Are you concerned?
Well, you know, we're in the red zone threshold.
Yeah.
That's one level below a lockdown, and they've fluctuated between sort of in the 30s, and then they were the 40s, and then they got into the 50s, and we were up, you know, we were alarmed at that. Then there was a little dip down again, and now it's starting to climb back up again. So anytime we see the numbers going up, that's the wrong direction. So of course we're concerned. But you know, order of magnitude difference between that and Peel, we're at 60 per 100,000. They're in the hundreds per 100,000, right? And so there's the virus isn't equally distributed yet across the province. There are areas that are really struggling and areas that are not as much. And so again, that targeted based approach, which we've advocated from the beginning of this pandemic.
The hospital capacity in Peel and in Toronto are getting alarmingly, it's getting an alarming point now, and a lot of you know, associations are calling out to Doug Ford and the Premier. What is the hospital capacity like in Burlington now for COVID-19?
We're good. Yeah, we're good, because our overall, even though we're part of a public health unit that's seeing the overall numbers go up, our community is actually still doing really well, as we have throughout. And thank you to all the residents out there for doing your part. It is working, and it continues to work, even though we are surrounded on all sides by red, you know, increasing infections. We're still sort of this little oasis of good behavior, and I really thank people for that. So we have the pandemic response unit, as you know, 91 beds that still sits empty. So that's good news. And we just got funding for an additional 41 beds.
Okay.
So, but the thing to understand is that the way they count hospital capacity is funded beds, right? There has to be money to pay for that ultimately, but that's how they count it. And every year at this time of year, hospitals across Ontario are full or over capacity because of all the other things that are health related that aren't COVID. So flu, or folks waiting for long-term care, or any number of other medical issues. So those beds are taken up by those folks, and then you find yourself at 100% capacity. But we have the ability, as I just said, through the Joseph Brant Pandemic Response Unit and the new beds for sure that we just got, to look after any surge of COVID patients over and above that. So certainly hospital capacity is a huge issue we have to look at, because it's not just COVID folks we got to take care of in this province. It's everybody who needs hospital care, and so that's why it's so critically important.
Has the COVID response unit had their first patient yet?
No.
Okay. So what are you guys doing right? Okay. So,
We're all staying away from people we don't live with. We're
okay.
doing this. Zoom, we're Zooming, we're
Yeah.
getting our recreation outside. We're, I mean, not, there are, obviously, we've had infections. There are people who have not followed those rules, and I certainly get reports of that sporadically throughout the city. So it's not perfect, but, overall, people have been very, very good about following the guidance and at the end of the day, keeping themselves, their families, their loved ones, their neighbors, and the whole community safer.
What would you say? I mean, what would you say to a business owner, a restaurateur, a gym owner right now that just heard that and just said, okay, there hasn't been one single patient in the COVID outbreak, the COVID wing of, sorry, what's it called? The COVID response
COVID response unit, yeah.
Sorry, the COVID response unit.
Well, it's pandemic response unit.
Pandemic response unit. What would you say to a restaurateur that's listening to that and going, why are we closed? And why do I have to close this Friday for a time that I won't even know when I'm allowed to open again?
So you have to look at all the indicators. And again, that was part of our message. Don't just base it on yesterday's infection rates that might have been high because tomorrow's might be different. Look at the R factor, which is the reproduction factor. If it's over 1, that's a concern because that's the rate at which it spreads. Ours is over 1. If you're over 40 per 100,000 population, again, it's an indicator of how much is out there and how quickly it might spread and get to unmanageable. We were at I think 54 when we were rolled into red. You have to look at the positivity rate. So how many people who have gotten tested are positive, and anything above 2.5% is red zone warning. It's a warning sign, and we're at 4.4. So, when you look at every other indicator, which are also important, that's why we're in the red zone.
Okay. So you say, I know you text the premier. Have you texted him and said, hey, are we going in lockdown this Friday?
Not yet, because I was involved in my other job as mayor of Burlington, so I haven't gotten the briefing yet, but I will, now that you've told me.
Let's do it right now. Let's do it right now.
All right, let's look it up. I'll text them. Are we going into, yeah, we'll find out.
Okay, I'm sure we will very soon. Dr. Williams said something really crazy this week and said that he's hoping by Christmas everybody will be in the green. Are we talking crazy talk, or is that realistic?
Well, that's hopeful.
Okay.
It's very hopeful. And, if COVID has a 14-day shelf life and everybody locked themselves down and did what they're supposed to do, in theory, it's possible.
True.
Because we're a whole lot longer than 14 days, but based on the modeling and the indicators, but they're based on turning the curve and the spread and all that, it seems very unlikely.
Let's talk non-COVID talk now. Is that okay?
100%.
Okay.
I have this other full-time job. It's called being the mayor of Burlington.
Yeah, that's true. Okay. So this is the Halton Mayors and Conservation Halton Board sent a letter to the Premier about proposed changes to the Conservation Authority Act. What are your thoughts on this? And maybe explain it in more layman's terms for the viewer.
The changes are terrible and they need to be rolled back. And the reason they're terrible is that they will potentially put human life, public health and safety at risk of flooding, not to mention property damage. It interferes with independent board governance by meddling in how boards should structure themselves, requires board members to act for their municipality as opposed to the good of conservation, which, I mean, it's just not a good way to go. And it could add red tape and costs and delays to development. And, one of my fellow mayors observed that this was a bill that, is very friendly to developers. And it is, and it's not friendly to the environment. And so, so many of the changes that had originally been discussed. So this consultation has been going on for some time. We had early indicators from the government that they had heard us around why certain things were necessary and not to change them. And it seems like that's kind of gone by the wayside. So we've asked them, we've joined with many other municipalities and conservation groups and individuals. I know many citizens of Burlington have written to their MPPs. Please keep doing that, to say that these changes should be stopped. And again, these were tucked into a budget bill as Schedule 6. So you're thinking about the budget. Oh, look, over at Schedule 6, we're overhauling in a really not environmentally friendly way, the Conservation Authorities Act. So they were put in place, as you will probably know, after Hurricane Hazel.
Yeah.
Incredible property damage, but worst of all, significant loss of life. And after that, we decided we weren't going to build on floodplains, because that's not a good thing. So the conservation authorities were developed to really protect watersheds and protect against development in floodplains. This weakens that. So think about that, especially at a time of climate change, increasing extreme weather events, our own experience with the Burlington flood. And by the way, all the homes that were flooded are in areas mapped. We wouldn't build there now. They're floodplains. Most of them are. So, we got to follow the science, and this doesn't follow the science. So that's our message to Premier is stop, push pause on this. Better yet, throw the whole thing out. And if there are issues with specific aspects of specific conservation authorities, then let those boards deal with it.
Is that another text to the Premier?
It might be.
Okay.
I didn't need to text him though, because we sent a nice letter
Oh,
with
okay.
signatures. So all 4 mayors issued a statement yesterday, or I think it was yesterday. And we also all signed a letter, including the board chair, who happens to be a Burlington resident, not an elected official. And so he signed it, all the 4 mayors signed it, and said, here's exactly what's a concern and what's at stake. And not to put too fine a point on it, human health and safety is at stake. And a whole bunch of other things too, but that's number 1.
I don't have any more questions. I did have 2 more, but it's funny how things change so fast. The school extension, it doesn't matter anymore because he already said he's not going to do it, right? And last week, funny enough, your comment on the fireworks got the most views by far. It got like 15,000 views. And that was after I said, is there anything you'd like to add to this conversation? So is there anything else you'd like to add?
Well, I got another early Christmas present yesterday. So as you know, we've been working on revising our new official plan, and it included new policies for the downtown to scale back the overdevelopment. But we're not the final decision makers. That's Halton Region. So we made our changes in October. There was a series of motions that myself and the Ward 2 councillor brought forward. They were accepted by council. The next threshold, or hurdle, if you will, was Halton Region. And as of today, they have sent back what's called their draft decision, approving our changes. And so next week, council, we have to endorse what the region did. So we send it to them and they like it, and then they send it back to us. So we do this little tango dance for a little bit, but it will be done next week. Okay. From City Council side. And then at that point, Halton Region has the authority to just say, okay, approved, will be subject to appeals. We expect appeals until those are dealt with, which could be years. It's not in legal force, but it will absolutely be available for us to use in our decision making. So very good news, the end of an extremely long journey, and we're 7 days out from that. So early Christmas.
And you've been working on that for a better part of a decade, correct?
Yeah, absolutely.
Yep. Well, yeah. Congratulations.
Thank you. It's a good thing I'm patient.
Yeah. Is there anything else you'd like to add to this interview or conversation that
I think we've got it covered.
All right. This is the shortest interview we've ever had, 26 minutes.
Well, I could talk some more if you want.
Anything else, but we can go and we can chat next week. I think 27 minutes now is good enough.
Okay, good.
Okay.
Well, good to see you. Take care.
See you next week.
Bye.
Bye.